All right, welcome everybody. I see that we have quite a few people already connected. So my name is Brenno Horst. I'm LMIS Tech Lead here at HISP Center in the University of Oslo. And I'm happy to welcome you to this webinar today. So this is part of a Gavi-supported webinar series hosted by HISP Center. And today we'll be talking about cold chain equipment lifecycle management and how that can be done in DHIS2, part of a greater effort to make equipment management sexy again, as I've heard some people say. So this will be our efforts to do that. For today's webinar, I'll be starting off with a quick intro and then a short demo on how this can be done using DHIS2. And then I'll be followed by Blessings Kamanga from Malawi Ministry of Health, who will be um, presenting how this has been implemented in Malawi and give some details both on the process of implementing, but also some points on the data use, which I think is a very key aspect, looking at how this can support uh, um, the equipment management and general vaccine management. He'll be followed by Edna Kiome from NextLeaf, who will show how then in Malawi as well, they've integrated the NextLeaf remote temperature monitors to the system and the different efforts around having this integrated digital integration between temperature and the equipment management, and how this data can be also, again, support decision making in the country. And then at the end, we'll have Per Kronslev, who's also working at HISP Center here at the University of Oslo as a supply chain advisor, who will give a summary and showing how this can support efforts in different countries as well. All right, so let me just jump into it and start with the quick demo. So this is, of course, a configuration using DHIS2. So it's not a new app or additional app if you already have DHIS2 running and installed. It's using the same system, the same database, the same user and organizations that are already in use if you have DHIS2 running in your country, which very many countries are implementing. Well over 90 countries worldwide using it. So this would be something that would be running on that existing implementation, and this is a configuration making use of the tracker data model. All right, so what I will do is just navigate to our website, and I'll show you where you can yourself navigate to dhis2.org/logistics. And on the logistics page, you will have a web-based walkthrough. And I'll show you that for one of the workflows now. So we click Show Me How, and I'll let you read through and see how that's done, logging into the app. And this is based on the Android mobile app. And here we'll choose only one of the workflows for now, but I'll speak through a few of the others. So cold chain appliance inspection. So this would be an inspection conducted daily or weekly, depending how it's configured, and conducted by a person who's then working at this clinic, be it a health practitioner or a technician, depending on staffing and the size of the clinic. So we'll just click on that. And then we'll go through the demo of how that's done. So first, you log in to the same screen and the same interface using the same user that you would have for other DHIS2 uses for other data capture. And we'll navigate through the different programs that you have available. And here we'll select Cold Chain Appliance Lifecycle Management. So we choose that specific program. And here we see a list of all of the different refrigerators at this clinic. This is just a demo, so you may not necessarily have this number of equipment. And here we're going to navigate to refrigerator 2. We'll click on the drop down and we see all of these different attributes that have been added, showing the refrigerator number, place of installation, PQS category, and so on, vaccine storage capacity in liters, gross volume. And these are all attributes that can be added and customized depending on the need. But this is a relatively complete list. And what you'll see here is, in essence, a skeleton configuration that can be used to start up this kind of implementation, but it can be, of course, adjusted and adapted depending on the needs. But you see those attributes. We can navigate back, and here we see then that refrigerator 2 and multiple different events that can take place that we can register then data to monitor and manage this piece of equipment. So starting at the top, it would be a transfer or installation when that equipment is first arriving at a facility and is going to be put into use, and you can register it. and add all of the data that I showed previously, the different attributes. You can conduct your temperature recording, and this is manually here, but as I mentioned, Edna will show how that was integrated digitally in Malawi, so that can be done as well. But it can be done manually if you don't have a digital RTM device. We'll go through the inspection in just a moment, and I'll click forward on that. You also have different types of maintenance, weekly preventive maintenance, and so on, and those can be configured according to the type of equipment. You can register and log the different alarms. You can make a repair request, and this workflow is also configured here in the walkthrough. So if you go through the walkthrough yourself, you can see how that is done. With the repair request, you can write, describe, include a picture of what the issue is. And then at a district level, you can have a technician who has a list of all of the different repair requests that have been made within the district at different sites, and they can plan their route to conduct repairs. And then that way you log and register all the repairs, not only for this equipment, but within a district, and that can be managed also through the same system. You have then the corrective maintenance, which a technician would conduct and would actually describe what was done. And you have the disposal or end of life. So in this way, from installation to end of life, you have a full self-contained digital record of how this device has performed and everything that was done throughout its life cycle. So here we'll conduct the inspection. We'll click on the plus and we'll add a new event. We confirm that it's the correct date and it's the correct facility. We click on next at the bottom. Once we've conducted the inspection, we see that everything is working as it should. Maybe we have a list that accompanies the device showing what kind of inspection should be done. We can click on yes, that the inspection was conducted. You can see that part of the completion is increased to 33% there. And then we add for the functional status, functional, non-functional. We select functional, it's working as it should. And we see that we've completed the entire inspection check, and we click on the save button. And with just a few clicks in a few seconds, we've completed that, that activity, and that record is now registered in the system. Once all of the different sites using this system have completed their check, you have a very clear overview of functioning and non-functioning devices in a facility, a district, or at a national level. And I think Blessings will also have one of his slides will show the analytics with that type of overview from the Malawi implementation. All right, so once again, this is configured within the DHIS2 system using the tracker data model. It's integrated in the existing DHIS2 with the same user access that the users will have for other data capture. And it comes with all of the same features and benefits that you would have with your DHIS2 installation. All of this data can be, of course, the metadata adjusted depending on the user level, the access level, and the specific equipment. So it's not hard-coded in any way with what we're showing here, but it can be adapted. And of course, it can be integrated, which we'll see again with the remote temperature monitoring. Data can either be accessed, pushed, or pulled from the system, depending on what is needed for reporting and management purposes. There are other use cases, and I think, again, focusing on the data use that we would like to explore. If there's something that might be interesting, a need that is not immediately covered here, we would be very happy to hear from you. So please reach out after the webinar, reach out, and we'd be happy to discuss how this can meet more specific needs, and if there's something that might be missing here that we haven't quite thought of. So we're very eager to speak to also any others working within the field that could add some more, perspective and enrich what we already have in terms of configuration and support. So I'll end it there, and I'll hand over to Blessings, who will continue showing then the implementation in Malawi. So please, over to you, Blessings.
Yeah, thank you very much, Breno, and good morning, good afternoon, everyone. Blessings, Ntezem Kamanga from the Digital Health Division, Quality Management Directorate, Malawi Ministry of Health. So I will present regarding the implementation that we have had in Malawi regarding the cold chain management, cold chain equipment management using the DHIS2. So prior to this project, the management of the cold chain equipment was being done using the paper-based forms, and in some cases using the Microsoft Excel files. So these files were based like in each district, they would have their own file and also their own format, having different columns and so on and so forth. But later on, there was some standardization in the sense that some Google Sheets were shared to capture the information. Much as that solved the issue of standardization, but it was still bringing challenges in terms of analysis, such that for one to analyze the data, needed to download the Google Sheets and then start making some graphs, some tables to do the analysis. And then because of that lack of analysis, it was very difficult to know the stock levels of the equipment, as well as the functionality status. And hence, whenever there are resources to have new equipment and then distribute them, there was inequitable distribution because one wouldn't know where the need lied. And also because of that, it led to lack of transparency and accountability because no one would know to say for some equipment which was procured, where it was, whether it was functional or not functional. Now, looking at to solve those challenges, the HS2 tracker was proposed to be used. So this was drawing on the experience that was there during the COVID-19 era, because during that time, there were some tracker programs that were configured for surveillance, and also taking advantage of the offline capability for the DHIS2 Android capture app, as well as the robust API that one is able to communicate the system, the DHIS2 to other systems. Now, with that, there was a design which was made. So the design looked at registering the equipment first. So during the registration, details such as what sort of equipment, the model numbers, the PQS code, and all other details that comes with the equipment are being registered. And then once registered, there are 3 stages. So the 3 stages, we have the cold chain equipment transactions. So for the transactions, we are looking at, for example, if the equipment has been registered, transferring it to some other location, receiving that equipment, conducting the preventive maintenance, corrective maintenance, and some other transactions that can be done on the equipment. And then apart from that, another stage looks at the operational status. So this one looks at on a daily basis, is the equipment functional? If it's not functional, what's the fault? Is it requiring a replacement? Is it just requiring maintenance? And then the other component is whereby we're looking at the temperature monitoring. So that's also where the integration came in, because our colleagues from NextLeaf have installed the temperature monitoring sensors in the cold chain equipment. So I think my colleague Edina will talk more on that one. And then in terms of data analysis, we're looking at analyzing data from the registrations of the equipment, as well as the various transactions, operational status, as well as temperature monitoring to say the alarm counts and so on and so forth. And then all that being put on the dashboard. And then in the long run, we're also looking at implementing the notification mechanism such that if somebody says the equipment is faulty, some cold chain technician or even EPI personnel at the headquarters needs to be notified to say that there's some equipment which is faulty, requiring some action. Now, the approach that we took with support from UNICEF country office, we configured the the tracker program based on the design that I just mentioned. So that was between late 2022 to 2023. And then upon configuration, to make sure that we are able to identify the equipment properly, there was a need to make sure that we have the QR codes printed. So on top here, you can see I have a sample QR code. So this QR code has some unique number for the equipment. So that's the QR code which was being pasted on the equipment once it's registered. That was being pasted on the equipment, and then it was being scanned. And every time one wants to look up that equipment, would not bother like searching in the system for the name of the equipment, the model number, would just come here and scan the QR code. And then in November, so with that, it means also UNICEF provided some funds to make sure that we print out the QR codes. So we printed, first we printed about 100 QR codes. And then in November 2023, some cold chain technicians were oriented. So these were from two districts, that's Lilongwe and the Nchisi districts. So upon orientation, they went ahead in these two districts, going to the various outreach clinics and recorded the equipment which was there. And then during also the same time, the national level team moved around these two districts to provide supportive supervision as well as troubleshooting in cases where the cold chain technicians were facing problems. And then upon doing it in these two districts, we also had some regional cold chain technicians which moved around the other districts to briefly orient other cold chain technicians, as well as to register some of the equipment which was there. And then as time went by, like October this year, we also had some support whereby 58 additional cold chain technicians were also oriented. So these were from 26 districts, so like Baraka, Blantyre, Machinga, Mangochi, and the other districts. And then there were some which could not make it to the orientation in October. So these ones had some learning sessions at the Lilongwe Technical College. So because the Lilongwe Technical College is just nearby, it's within Lilongwe. So we took advantage of that and we went there and also oriented 14 additional cold chain technicians on how they can use the system. Now, having done all that implementation, the idea was to make sure that that should provide data to make informed decisions. So in that regard, there are some dashboards which have been configured on the system. So for example, the graph that you see here is showing the operational status of the equipment for the past for the past 3 months. So here we're able to check to say within the past 3 months, how many equipment are functional, and how many are requiring maintenance, how many are not functional, and how many are requiring replacement. So for example, here already you can see for Chikwawa, we have about 3 equipment which are not functional. And then for Cholo, Decho, we have about 6 equipment which are requiring replacement. And the same applies to Zomba, where we have 2 equipment which are not functional, as well as 2 equipment which are not, which are requiring replacement. So that can also be done, for example, on a daily basis. It can also be done per weekly basis, and that can form the basis from the system, the various data of the device installed. Okay, and then apart from that, we're also able to know the transactions that have happened on the equipment. So for example, for the last 6 months, we're able to check to say how many equipment have been registered, how many have had planned preventive maintenance conducted on them, as well as how many have had corrective maintenance conducted on them. So here, if you see, every month we have some equipment being registered. So in the month of June, we have about 435 equipment registered. And then in the same month, we had about 220 equipment, which had the planned preventive maintenance conducted. And then we had about 4 which had corrective maintenance. It means there were 40 at some point in time, and then the corrective maintenance took place around June. And then the trend goes on like that, as indicated on the graph. And then apart from that, it also enforces transparency and accountability in the sense that for each piece of equipment, we're able to check to say by who supported the procurement of the equipment. And then through the line listing, we're also able to track to say for each equipment that a certain donor supported us with, we're able to trace to say where it is, whether it is functioning or it is not functioning. So for example, here you can see we have different partners on the different donors on the left, and then the equipment which have been indicated to say they have done that. So because not all equipment have been registered in the system, so maybe that's why you're also seeing those figures. But also at the time of registering, some equipment wouldn't be determined to say, because remember I already mentioned to say that I was being kept in Excel at that time and the right. So at the time of registering, it couldn't be indicated to say which donor exactly supported with the procurement of that equipment. So that's why most of the times for that one, they were just being indicated to say it was UNICEF supported. So that's why we even have under UNICEF, we have some high number there. But it means moving forward, once all the equipment are registered, we'll be able to be transparent and also be accountable to the different donors in terms of how the equipment is distributed. Now, there have been challenges. So one of the challenge, it's regarding poor data quality. So for that one, like I mentioned, because now it's like we're doing the initial registration, there was for all the equipment, it means you don't find all the necessary information to update with. So that led to having some incomplete information when registering the equipment. And then apart from that, I already mentioned about the training to say that it's based on the resource availability. So not everyone has been trained on the system. So even the training that I mentioned to say we included personnel from 26 districts. So we are just taking 2 personnel per district, but there are still more people that need to be trained on the system. And then poor connectivity in some areas. So in some areas, it's very hard to get some signals. Thanks to the offline capability of the DHIS2 Android Capture app, at least people are still able to use the application, but still more, they have to walk some long distances to make sure that they're able to sync the data that they have captured. And then inadequacy of gadgets. So of course, there were some gadgets which were distributed in the districts for some other interventions. So temporarily, those gadgets are being used to capture the data, but there are also some other personnel which are using their own gadgets to capture that. So that brings in a challenge. But also even for those that have tablets, it means there is a need to make sure that there is a sustainability plan such that over time, when those gadgets, maybe they have been damaged or they are not operational, it means there will still be a need to make sure that there are gadgets to be updating the functionality status of the equipment as well as registering the new equipment. So those are some of the challenges that are being faced. So recommendations, pronto availability of resources, it means there is need to make sure that they are trainings conducted for cold chain technicians, API coordinators, as well as some other personnel on the system. And then also sustainability for the gadgets, as well as some other IT equipment is also required. And then also the remote temperature monitoring is not done, the temperature monitoring is not done manually. It's done through the integration. So it means there'll be need to make sure that the integration is monitored so that if there are any issues related to that, they are well managed. And then also promoting data use. So there is a lot of data captured in the system. So we have to make sure that this is being used to make some decisions. So like I showcased to say we have some areas where we have equipment and requiring replacement. So if no action is taken to replace those equipment, it means the system is not being used to its maximum capacity. So those are some of the recommendations, and that marks the end of my presentation. Thank you very much. Asante sana. Merci beaucoup.
Thank you very much, Blessings. Very insightful, a lot of considerations and a lot of hard work. So congratulations on that. We look forward to following along how that develops. Now over to Edna on the RTM integration. Over to you.
Thank you, Brenda. My name is Edna Kiome. I am a director for emerging product at NextLeaf. I'll be speaking to you a bit on the work we've been doing with the ministry in Malawi regarding this integration. Just to get started, NextLeaf is a non-profit organization. And what we do is we provide solutions, both hardware and software, that gives end-to-end visibility for cold chain equipment to ensure that vaccines are monitored during both storage and transport. And specifically in Malawi, we are monitoring over 1,000 cold chain equipment. Now, just to dig deeper on what these solutions are, so then we can have an understanding of how the integration works and what data we capture. We have 3 solutions. The first one, as you can see on your screen, is a CT5 device. This device, we have the hardware, which we have the sensor that goes into the CCE component, and then transmit the data to the base station, which is the black component, and then that is pushed to the dashboard. What we've configured in the solution is we collect data every minute, and then we broadcast that data to the dashboard every 10 minutes. The second solution you can see here is our new version of it, which is a CTX. Instead of the keyboard sensors, what we have is Bluetooth devices. So a bus station can have about 16 sensors in different cold chain equipment, and those transmit data every minute, which we broadcast to the dashboard every 10 minutes. And the last solution is for transport. That sensor can be used during transportation of vaccines. So specifically in Malawi, we are working with the ministry to monitor cold chain equipment and vaccines in storage. So what happens with the solution is once the base station connects, we are able to log both the data within the cold chain equipment and also within the door sensor, right? So we're able to know when the fridge is opening, when it's closing, should it be a walk-in freezer? So all that data is gathered. Then at the facility level, what we do is we trigger alarms from the system, from the device itself, but also we send SMS and email alerts in case of any excursions or temperature fluctuations. And then, as I said, all this data is collected into a dashboard. Now, specifically for Malawi, what we did with the Ministry of Health is there was need to really look at what can this data be used for, which I'll be talking a little bit about. So what we did in Malawi is, because we agree, this is a lot of data that we collect every minute, right? So what we discussed with the ministry is How do we have aggregated data, which we will be sending to DHIS2 every end of day? And then that data can be used for what we had earlier discussed, and I'll talk about it, some of the components we've seen not just in Malawi, but we are discussing with other ministries in other countries on how this data can be used. Not just being able to tell the user at the facility level that the vaccines are not within the temperature range, do something, add ice packs, check if the fridge is working, but what more can this data do? So specifically for Malawi, we agreed with the ministry. These are the 6 metrics that we'll be sending to DHIS2 every end of day. The first is the minimum temperature, maximum temperature, average temperature, the number of hot alarms that day, and the number of cold alarms. Now, the last component was also very critical to the ministry, and this is uptime. So this shows the amount of time a specific equipment is within the appropriate temperature. So for example, if the fridge is set to be within 2 to 8, so uptime will compute the amount of time it's within that temperature range. And this speaks a lot about the performance of the fridge. And if you look at these 6 metrics, the reason we discuss this with the ministry is you can use them as building blocks for different decision making, right? So you can think of them, as I mentioned, one, maintenance, different components that can be used for this. Because if you are to remit all the data points we collect, that will be extensive, that will be a lot of workload. DHIS2 really is to aggregate and analyze the data. But also really, if you look at these metrics, it's easy to aggregate them across different days, weeks, months, and tell a story about the coaching equipment that you're monitoring. Now, as we proceed, one of the things we've been seeing, not just in Malawi, but in all these countries we work in Africa and Asia, is the temperature data. And the ministries are understanding that, one, it's for immediate response, which is just to say, hey, go check that fridge at the facility level or in the vaccine store and make sure vaccines are saved. But what more can this aggregated temperature data collected over time help ministries do? What decisions can they make? The first one, which we've really talked about, is performance, right? How can we support ministries to use this data to really detect an equipment even before it fails? As I mentioned, if you look at the uptime data, which we are pushing to DHIS2 in Malawi, it's able to tell you, for example, this fridge within this week, it's been within the uptime period within 50%. That means there's something. So if the power is not an issue, then what is happening to that coaching equipment, right? So they're able to detect underperforming equipment early enough. And remember, resource constraints is an issue here. So we're talking about a few biomedical engineers who have to cover different facilities. So they're also able to know when to focus. Where do they focus? If they have this data, then they're able to really direct the resources where it's needed. They don't have to wait. And I think Blessings covered on what the component is being used for, right? We don't have to wait for the equipment to break down if we can just do a bit of preventive earlier. If we're able to detect something that is not performing and somebody can check it before, that's one of the components we've seen this data being used for. But also it also speaks about logistics of delivering of vaccines, right? As they deliver and plan delivery of vaccines, they're quickly able to tell by checking the temperature data or uptime of coaching equipment, which fridges are operating, which ones are not operating. And within that, they're able to schedule the delivery. And the last component of the core of what we've seen with different ministries is really resource prioritization, right? There are constrained resources. If you listen to what Blessing was talking about, resource is a constraint always. But then what is it that the ministry can prioritize, right? So for example, if you're talking about a certain district that keeps on having challenges with their coaching equipment, should the ministry look at maybe possibly looking at how old those fridges are? Is there an issue in that region? Is it power issues? Just be able to know where to prioritize the constrained resources that they have. But basically what we are saying is what we've seen with ministries as we work and, devices collect this temperature data is temperature enhances vaccine management, but also it can be used in the day-to-day running of the ministry to help them make decisions. And that's what we've been doing, and that's what we are seeing in Malawi. And that's really the need that was there for this integration to happen. As I conclude this conversation, ideally, what we are learning is it's not just about collecting data, right? Ministries have this extensive data, but systems have to speak to each other, right? How do we have a maintenance component and then use that temperature data to make sure it's improved, even that module within the maintenance tool? Systems have to speak together. Data has to be used across. So how do we make sure that data is flowing to all the systems it's supposed to flow into? And then also, how do we equip these health workers to ensure they can use this data day in, day out? The case and example I gave about the biomedical engineer, right? How do we make sure as somebody is logging in to log maintenance request, they're also able to jump into the system and say, but I can see the uptime of this fridge has been good. What are we missing? And then also just basically build that culture of data use across is what we've been working on, and just hearing from ministries across. So in my conclusion is that we are looking at, and Malawi is really a great example of this, how solutions can speak to each other to ensure that, silos doesn't help. Aggregating this data helps ministries make decisions and also makes the process more effective. That's it from me. Thank you, everybody.
Great. Thank you so much, Edna. Thank you for providing further insight and how data can be shared then between the temperature sensors and DHIS2 and to provide value. And I think there's a few points there that you mentioned that I think we can highlight for the summary. Maybe I can hand over to Per Kronslev, who can speak to that, to summarize and kind of look at a way forward for these opportunities. And then we'll have some time for question and answer. I think there's already a lot of questions in the chat, so thank you. A lot of engagement, that's good. But over to you, Per, before we go to questions.
Okay, so I'll make a quick summary. So the first thing is, this is configured in existing DHIS2. Does not demand a new piece of software. It's existing DHIS2, the tracker. It's set up in. Second thing is that it's relatively simple and low cost to set up. In Malawi, this has been done with local resources and quite quickly implemented. So that's a couple of important things. Now, then there is another thing is that, yes, this is used for management locally of the cold chain equipment. You get you can see how your equipment is performing locally and so on and so forth, but you can also do a national management, right? So, and that has a couple of aspects to that. One is in terms of replacement, of managing the whole fleet. When you need to know how much to buy of what equipment, then you can use this to see what do I have, how old is it, and thereby also start working on what replacements do I need. Another thing is for logistics, for the supply chain, because this kind of overview tells you how much space do you actually have working at every health facility, and both for freezers and fridges, right? So when you're planning your distribution, you can go and see, okay, I have this much capacity at these levels, at health facility, at hospital, and so on and so forth, and that's very helpful for the logistics. So it works both for the local level, for the central level. It's a good tool for the maintenance people. There's a lot of advantages to this. And then obviously, if you have it linked to the temperature monitoring specifically, you can do even more, right? So yeah, that's kind of a summary. And I think I'll hand over to you, Breno. There seems to be a lot of questions.
Yes, thank you, Per. Thank you for the summary. Thank you again to Blessings and Edna. There are really questions for everybody, I think, that has presented, and I think there are questions also to our technical team, a few questions related to the DHIS2 system. So I think we'll have to maybe get back to you on a few of those, but maybe we can go to Donald, who has his hand up. Do you want to take the first question? And then I can maybe round out a few of the key questions that were shared in the chat. Over to you, Donald. Okay, I'm trying to unmute Donald, perhaps not working. Maybe I can speak then to one of the questions that was asked, that this is configured as a native tracker program. Each cold chain equipment is a tracked entity instance enrolled at the facility. The attributes, some of them are input by the user at the time of enrollment, while others are integrated with PQS attributes. It also touches on another question related to the type of equipment and spare parts. So all of those can be, the specific name, brand, place of manufacture, and so on. Those can be taken either from PQS or input by the user. I believe one of the visualizations that Blessings showed was an overview of the equipment, and it was broken down both by donor, but you can also have a breakdown by manufacturer, and these can be used for the purposes that were mentioned for planning for spare parts and management. We haven't developed that yet, and we're very keen to work with those of you interested who have this need. Happy to explore how to have that further developed. I think it's a more advanced use case related to cold chain equipment, so that would be great to have more insights and discussion. Um, and then also HR planning, being able to have programs that train and capacitate technicians to be able to manage and maintain this equipment at a district level. So that's really great. And again, native features. If you have DHIS2 now, you can pretty much have all of these features. And if you have the latest version of DHIS2, you can have every one that we've shown here today. Also for accessing that, I shared the configuration guidance, which is on the HISP Center DHIS2 website, docs.dhis2.org. And under implementation, you'll find a section on logistics and cold chain equipment. And I'll share that again. I can share with all of the different participants that have registered here. Another aspect that I think I want to highlight that maybe came out in both presentations, but also I think is a key point is that not everything and not all data needs to be in DHIS2. One of the key aspects that is built into the software is interoperability, integration, data and metadata is easily accessible through the API. And the intention is not to have DHIS2 do everything. We do not want to push raw data from every temperature monitor into DHIS2. So exactly what Edna explained with this discussion and engagement with the ministry to understand what are the key indicators that they want to have within this platform, which can be used for either reporting, operational management, tactical or strategic decision making. What is needed to bring into the DHIS2 platform for those purposes, and what should be done in a different platform. And I think that, again, is part of the discussion that's really important between different vendors and technology developers and ministries that are implementing this. How do we find that perfect place where DHIS2 can support and help decision making and so on without going into different areas where maybe it's not providing as much value. So I think that's a really important aspect, and I think it was well highlighted there. And then lastly, Samuel, quite a few technical questions. So I'll definitely get back to you on those. I don't have an immediate answer. I think on the first one, though, Rajab, also from the Malawi team, explained that there are different data validation tools that can be configured to help improve the data quality at the data entry point so that you have a bit more reliability on that data that's being captured. All right. I don't know if there are maybe more questions or if somebody else wants to comment on what's been presented. As I mentioned, for the way forward, please reach out to us. We're very eager to understand new use cases, different needs that were not immediately covered. Here you have our contacts linked to the guidance and the logistics page where you have the walkthrough. So we're eager to hear from you. Let's see. Yes, ecosystem of data shared between RTND and DHIS2. Yeah, so there are, again, meeting stakeholder requirements for reporting and compliance with health regulations. Yeah, there are extensive analytics and reporting functionalities that can be configured. Understanding, Abdurrahman, exactly what those are. For example, if there are key indicators, how those should be calculated. That's exactly the kind of insight that we want to have so that we're able to include it in our configuration guidance. What is the data, the indicator, and the needs that you have there that we're trying to meet with this tool? If you can share with us, we're happy to discuss. All right. Wendy, I think, can we try to give Wendy the floor? Who has her hand up? Let me see.
Telling me that's
There you go.
yes, it works. Great. I love technology when it works. A question on, and this was in the chat, on spare parts inventory management, and if that's part of what this module does or can do. I like the predictive part of where you can look at what spare parts are being used, but is there a component for the spare parts inventory as well?
We don't have that configured directly in this program, and that's the kind of thing that we would like to do. We do have both a stock management tool in DHIS2, and we have stock reporting, so that is possible, but we want to explore what the needs are for that. We're focusing on drug and medicine management, quantities, distribution, and so on, but it would be great to include that as part of the package to be able to manage drugs and have it integrated. For the time being, this would report the needs for that equipment. But sure, that's one aspect that we would like to understand more and to incorporate. Maybe Malawi, Blessings, who's already implementing and has this used in many different sites, that could be a next use case for him to tackle how to incorporate the spare part management, but definitely something we're hearing from multiple different partners on needs for the spare part management. All right. If there are no more questions, I think we can maybe round it off there. We will have this recording shared on our YouTube channel so that you can access it again. And I will share more information with all of the different participants here so you can go on these different links and look at the implementation guidance at the walkthrough and to learn more. Once again, do not hesitate to reach out to us. We're very happy to hear from you and we will be in touch. Thank you so much for joining. Bye for now.